Today's topic is, as is told, helminths are broadly the protozoa, the parasites are classified into either day I told. Protozoa and helminths. Okay, protozoa and helminths. Now, protozoa are unicellular. Helminths are multicellular. These are classified into cestodes, trematodes, and nematodes. Cestodes are tape-like worms. Trematodes are leaf-like. Nematodes are roundworms. So, in roundworms, you are going to study Ascaris lumbricoides. Ascaris lumbricoides. Next one is Ancylostomum. Only there. Yeah.
Sir, not the vice versa.
Okay. Ascaris lumbricoides. Then there are three hookworms. What are three hookworms? One is Ancylostoma duodenale, Nectar americanus, Troglodytes turcoraris. These are three hookworms because the anterior end is bent like this. Anterior end. This is a round worm. Okay. Then Trichuris trichura. Trichuris trichura is called whipworm. Posterior end is thick and anterior end is thin. Trichuris trichura. Then Trichna worm. Then Entropius vermicularis. Entropius vermicularis. So 1, 4, 5, 6, 7. Okay, there are 7 intestinal. They are intestinal nematodes. Extraintestinal or visceral lymph node, extraintestinal visceral lymph nodes are Uchraria bankrafti, Uchraria bankrafti, and Dracunculus medinensis. This is commonly called as filarial worm. And this is called as guinea worm. Uchireria bankrupti and Recunculus medinensis. So how many worms totally? 7 plus 2, 9. Okay. 1, 2, 3, 4, 5, 6, 7, 8 and 9. Okay. Now the examination is done by stool examination. Ascaris has got bile stained egg. One is unfertilized. It's not round like this. Another Ascaris, you can see the embryo inside. That is bile stained. Both are bile stained. Okay. Now this hookworm eggs are non-bile stained. They show 4 blastomeres. 4 blastomeres, non-bile stained. Whereas again, Trichuris trichura, that is whipworm, is bile stained. Barrel shaped with bile stain. These are mucus plugs. Again, the Enterobius vermicularis, commonly called as pinworm, seedworm, threadworm. It is plano-convex worm, egg. It is non-bile stained. So you remember with the mnemonic, okay? All tapeworms are like uh, Tinea saginata, solium, or bile stain. So they have inside there are 3 pairs of hooklets. 3 pairs of hooklets. These are bile stain. So tapeworm, then Ascaris lumbricoides, then Trichuris trichura, Trichinella spiralis. And Trichuris trichura, whipworm. So PAT, remember, bile stand for tat. Tapeworms, Ascaris, and Trichuris trichura. Everybody, repeat with me. Bile stained eggs are eggs of tapeworms, eggs of Ascaris lumbricoides, eggs of Trichuris trichura. That is whipworm. Non-bile stains are hookworm, Anglosoma duodenale, or remember it as hookworm. Okay. Then this one. Hookworm is this. Then this one. Plano-convex. I said this is Enterobius vermicularis. Or non-bile stain. So this you remember AE. Ankylostomata duodenale and Enterobius vermiculare, the non-bile state. Usually we do stool examination with two preparation. One with saline. This is cover slip. This is with iodine. Saline and iodine. Saline is for demonstration of eggs to differentiate between bile stain and non-bile stain. Bile stain and non-bile stain. Iodine preparation is demonstration of cyst, which stains the nuclei, chromatid bars, and glycogen mass. So, repeat with me. We do two preparation for stool examination. One saline preparation. This is mainly done to demonstrate the egg and differentiate between bile stained and non-bile stained. Example of bile stained eggs are Ascaris lumbricoides, Trichura, eggs of tapeworm. Eggs of tapeworm. Or you remember it as Ascaris A, Trichura, and tapeworm. At A double T. At non-bile stained are hookworms and pinworm. Or you can remember as Anklostoma duodenale, Enterobius vermicularis. AE. AE or HP. Okay. Remember like this. Okay. Ascariasis is a roundworm. Everybody. Ascariasis, roundworm. Largest nematodes present in the intestine. Where it is present? Habitat. You have to write habitat. Okay. Habitat in the intestine. And it is called, common man's name, it is called roundworm. And it is soil transmitted helminth. The eggs are presented in the soil. Okay. It is cosmopolitan distribution, fecally contaminated soil, clay soils, risk factor, children, malnutrition. Three forms: adult cylindrical, measures about eggs fertilized and unfertilized egg. The life cycle. So, life cycle, man get infected by consumption of eggs, embryonated egg. In water or food. Man get infected by consumption of embryonated eggs in the water or stool through oral route. Okay. And from you go to the intestine, they will not develop intestine only. They develop, go to the intestine and go to the, where they go to the ingestion of egg from here. From here they go to the lungs. From here they go to the lungs. And again they creep up like this from pharynx. Again they are swallowed back into the intestine. Larvae are coughed up, re-enter gastrointestine, and maturation takes place in the small intestine. So don't end the cycle here only. Okay, from intestine they go to the lung and come back to the intestine. Everybody, ingestion after ingestion of leg, they do not develop into male and female adult worm. They go to the lungs, creep up to the trachea, and swallowed back into the esophagus and develop into male and female adult worm. Adult and male female worms copulate and develop into give rise to eggs. Eggs are secreted in the feces, stool. That is the life cycle of Scaris lumbricoides. The further development takes place in the soil. Okay. Pathogens is what all happens. One is host response, migration of larva, mechanical obstruction of adult worm, and nutritional deficiency. Incubation period is 60 to 7 days. So larva creeps up and it goes to the lungs. No, first in the intestine. From intestine they go to lungs and come back to the intestine. So it gives rise to in lungs Loeffler's pneumonia. Which is also called as eosinophilic pneumonia. In lungs, it is called Loeffler's pneumonia, eosinophilic pneumonia. In intestine, sometimes without doing anything, they are there. One thing is they rob the nutrition, giving rise to what is called as malnutrition, and allergic manifestation can go rise to urticaria and conjunctivitis. So, laboratory diagnosis, how do you do laboratory diagnosis? Stool examination. So, you get fertilized egg, saline and iodine wet mount, concentration technique, sedimentation method, bile stain, do not float in the salt solution. So, these are right on the diagrams of the bile stained egg, that is atrophied ovum, that is decorticated egg. Diagram. Mammillated albuminous coat, unsegmented ovum, gastronic space, fertilized corticated egg, unfertilized egg, atrophied ovum, decorticated egg, which shows no mammillated albuminous coat. So the life cycle you will write like this. Man, look it here. Man get infected by ingestion, food and water contaminated with the embryonated egg. They go to the intestine. They do not develop into the adult and male and female worms. They go to the lungs, come back to the intestine, where they develop into male and female adult worms. They copulate, produce eggs. Eggs are passed in the feces and soil development phases. Again, man get infected. This is the life cycle of Ascaris lumbricoides. This is the life cycle of Ascaris lumbricoides. This is a simple way to remember life cycle. Okay. Only you should not end in the intestine here. Okay. You should take to the lungs and bring it back to the intestine. Written the diagrams? Okay. Life cycle and diagram. So this is again eggs. One is embryonated egg, fertilized egg, unfertilized egg, decorticated egg. Sometimes worms comes out in sputum. You can see in by naked eye. You can do barium X-ray of gastrointestinal tract. Look for the abdomen. Trolley car lines, that's in X-ray, ultrasound and cholangio, pancreatography, extraintestinal parasites. This is how it looks adult worm. Larva detection sometimes in the stomach, aspirate, sputum. Antibody can detect by doing ELISA, enzyme linked immunosorbent assay, to how sensitive differentiate between recent and past infection. All helminthic infections are cross-reacting. Most therapeutic purpose, assessing transmission area of aiming elimination. PCR, polymerase chain targeting ITS1, cytochrome oxidase, Ascaris in the stool. Multiplex PCR, simultaneously differentiate between Ascaris, Trichuris and hookworm. Real-time PCR, that is polymerase chain reaction, quantitation of parasite load in the stool. Eosinophilia is prominent during early lung stage. Charcot-Leyden crystals, sputum and stool. Non-specific finding of seen in Ascariasis. The drug treatment, albendazole, 400 milligrams once a day, or mebendazole, 100 milligram BD for 3 days, or 500 milligrams once. Alternative drug like ivermectin, 150 to 100 milligram per kg body weight. Nitazoledine, pregnancy, parental format. These are the drugs that are given for the treatment of roundworm infection. Patient sometimes going for intestinal obstruction, and sometimes complete obstruction, because if many worm load is too high, it results in complete obstruction. So in short, we'll summarize all the parasites one by one. You have to tell. Now we'll go to the important. What's your name? Naveen. Okay. What is the difference between definitive host and intermediate host? Naik, Ramdas Naik. Where? What's your name next? Rosa. Chalo. Definitive host, sexual stage of parasite. Everybody. In definitive host, sexual stage of parasite. Everybody. In definitive host, sexual stage of parasite. In definitive host, sexual stage of parasite. Definitive host, sexual stage of parasite. In intermediate host, or sexual stage of parasite. Man acts as intermediate host in two parasitic conditions. One is malaria, another is Echinococcus granulosus. Echinococcus granulosus. Echinococcus granulosus. The first parasite in the parasitology is entamoeba. Entamoeba histolytica. How man get infected? What is the infective form? What is the infective form? Entamoeba histolytica. Quadrinucleate cyst. Ingestion. Habitat in the descending colon or sigmoid colon. It gives rise to amoebic descent. It gives rise to flask. Flask shaped ulcer. So you have to do stool examination for iodine and saline. Saline for trophozoite. Trophozoite moves with pseudopodia. Cyst, you can see quadrinucleate cyst. The extraintestinal abscess, it can give rise to abscess in the liver, lungs, brain, kidney. Abscess in the liver, lung, kidney, and brain. Second parasite, Giardia lamblia. It is present in duodenum and jejunum habitat. Man get infected by ingestion of cyst. It causes giardiasis. Giardiasis, especially fat malabsorption. Again, you have to demonstrate cyst and trophozoite in the stool examination by doing saline and the identification. Third parasite in this group is Trichomonas vaginalis. Please remember there is no cyst in this. Only trophozoite. There is no cyst, only trophozoite. It is only sexually transmitted STD, sexually transmitted disease, parasitic disease, sexually transmitted parasitic disease, sexually transmitted parasitic. It gives rise to vaginitis in female and urethritis in male. Vaginitis in female and urethritis in male. Next parasite, Trypanosoma brucei. It gives rise to sleeping sickness. It is transmitted by tsetse fly. Don't worry about this because just viva question we may ask sometime. Next is Trypanosoma cruzi, transmitted by rootweed bug. Rootweed bug. It gives rise to Chagas disease. Gives rise to Chagas disease. The next is malaria. Plasmodium vivax, Bile, falciparum, malariae, knowles. Vivax, Bile, falciparum, malariae, knowles. Man get infected by the bite of female Anopheles female Anopheles. Man get infected by the bite of female Anopheles mosquito. Man get infected by the bite of female Anopheles. It gives rise to intermittent fever. Torsion. Fever spike once in 3 days. In all except in the malaria, once in 4 days. Once in 4 days. Knowles once in every day. Every day. Within 24 hours. Okay. Laboratory diagnosis, you have to do thick and thin smears. Thick is to detection of parasite. Thin is for species. It is usually stained with Giemsa stain, JSB stain, Romanowski stain. Okay. The quickest method of diagnosis is done by doing, you take a capillary, it is quantitative buffer QBC, quantitative buffer. Take capillary tubes coated with acridine and this centrifuge it and see under ultraviolet microscope. Malaria parasite gets stained with fluorescent dye. They fluoresce under, this is quantitative buffer coat QBC. Then we have card test like how hepatitis B, hepatitis C. We have a card test which gives control to detect two enzymes produced by malarial parasite. One is aldolase, next is histidine-rich protein, aldolase and histidine card test, histidine-rich protein, histidine-rich protein. This is malaria. Okay. So this falciparum is very dangerous because the RBCs are broken down in cerebral area. It gives rise to cerebral malaria. And microvascular system of the kidney gives rise to black water, black water fever. Cerebral vascular system of the cerebral malaria and black water fever. And it is very severe, can give rise to algid malaria because it attacks both old and new RBCs. Next is Leishmania dormani. Leishmania dormani. Man get infected by the bite of sandfly. Bite of sandfly. It is called zoological name of sandflies, Phlebotomus. Phlebotomus argentipus. Phlebotomus argentipus. This promastigote. Promastigote are infective. Infective. Promastigote form infective. Habitat of parasite is in the reticuloendothelial system. They are present in the reticuloendothelial system. Macrophages, monocytes as a amastigote form, non-flagellated form. That is amastigote form. So it gives rise to hepatosplenomegaly and skin becomes dark and wrinkled, fever, bone marrow suppression, anemia, aplastic pancytopenia, and man become immunocompromised, get infected with super. So laboratory diagnosis is done for the, you have to look for peripheral smear. In peripheral smear, you can look for amastigote form. These are also called as LD bodies. These are also called as LD bodies. These are also called as LD bodies. There are free living amoeba. Man get infected directly through inhalation. They give rise to primary meningoencephalitis. Primary meningoencephalitis. They are found in the pond, swimming pool. These are Negleria, acanthamoeba. Negleria and acanthamoeba. They give rise to primary meningoencephalitis. Directly through the nose, go to the brain and give rise to primary animals. There are some opportunistic infection which occurs in the immunocompromised patient. Immunocompromised patient. They are pneumocystis carinii, HI patient. Cryptosporidium parvum. This gives rise to pneumonia. This gives rise to diarrhea in HIV patient. In HIV patient. The next parasitic worm is Valentinum coli. This is a pig's worm. Man get accidentally infected. It's just like Entamoeba histolytica. It is gives rise to diarrhea, Valentinus. The consumption of cyst. Valentinus. Okay. The last one in the protozoa is Toxoplasma gondii. Toxoplasma gondii. Man get infected by consumption of oocyst present in the feces of the cat, which contaminate the food and water. So it gives rise to what is called as Toxoplasma. This is in briefly about the protozoan parasite. What is the beef tapeworm? Name of the beef tapeworm? Beef tapeworm. No, beef tapeworm is Tinea saginata. Pork, Tinea solium. Man get infected by eating pork or beef which are not cooked or partially cooked. Then dog tapeworm, Echinococcus granulosus. How man get infected? Man get infected by eating food or drinking water contaminated with the eggs. Which are present. Eggs are, this is life cycle is going on between the dog and the sheep. Man become accidentally infected by consumption of the egg present in the feces of the dog. Okay, and it gives rise to hydrated cyst. In the liver. Okay. Then there is a fish tapeworm. What is the name of fish tapeworm? What is the name of the fish tapeworm? Hold like this. It is double head. Diphyllobothrium latum. Diphyllobothrium. Man get infected. Consumption of fish is not properly cooked. That is called. It gives rise to pernicious anemia. Gives rise to pernicious anemia. Beef tapeworm, pork tapeworm, dog tapeworm, fish tapeworm. There is a rat tapeworm. It is called a Hemolopis nana. And there is a dwarf tapeworm. That is called as Hemolopis diminuta. Dog tapeworm, which is called as. So many tapeworms are there. Beef, saginata, pork, solium, dog, Echinococcus granulosus, fish, Diphyllobothrium latum, rat, Hemolopis nana, dwarf diminuta. चलो, थैंक यू वेरी मच.